Hello people, Richie here again, Richie Reports UK. Just a little bit of information about a new video that UKCOLUMN team have put out. Came out today, Tuesday 22nd of November 22. All about the pharmaceutical industry. Brian Garish and Debbie Evans are talking to a couple of experts that work for the pharmaceutical industry in Big Pharma about what's going on inside the pharmaceutical industry, how drugs are developed and marketed and distributed, moved around, and what the ulterior motives for some of them are. Not what you'd probably think. Quite different from what you quite think. Quite a revealing video. It's an interview, about an hour and 20 minutes long. It's a good long, well worth watching and taking in. But I can't really post it up on this channel because it'll probably get taken down due to the content. And don't want to get any more strikes on here on this channel. So what I'll do, I'll leave a couple of links either in the description underneath or over there, and or in a comment below the video, and I'll post the links up under this video. And what I'll do after the end of this little video, I'll just put a 5-minute introduction at the beginning of the program, show you what they're going to be talking about. I'll pop that on the end of this video. See you on the next one, then, people. Just keep looking, you'll see the end. After the end of this video, you'll see a link to the video and a little 5-minute introduction.
Good afternoon and welcome to the UK column. We have a fascinating discussion lined up for you this afternoon. Debbie Evans brought together two extremely interesting people, Hedley Rees, who has spoken to us before on matters to do with vaccines, pharmaceutical industry in particular. And today we're delighted to have a lady called Sasha Latypova joining us, who has inside experience of the pharmaceutical industry and what it does. So Debbie, I'm going to say thank you very much for putting this together. I'm going to hand over to you.
Brian, thank you very much. And thank you so much to Sasha, who has gotten up very early in order to be able to speak to us. And welcome back to Hedley. And as viewers and listeners might remember, we've had a fascinating discussion with Hedley. The interview can be found on UKCOLUMN website, Molecule to Man. And we were discussing how your drugs end up in your drug cupboard. What journey have they made from the laboratory, from where they were made, to actually inside your cupboard? So we had a fascinating discussion with Hedley, and a lot has come up since we've spoken last. And I know that we're going to touch on a few points, such as perhaps the reason that the mRNA vaccines were frozen, perhaps they shouldn't have been. So we'll be exploring that with Hedley. But I know that Hedley has been working very, very closely with Sasha, who has been working within the pharmaceutical industry for very, very many years and has had all sorts of inside knowledge and has been doing a lot of data analysis, mainly on the VAERS data in the US with regards to Pfizer and Moderna. So first of all, I would just like to welcome you both. And maybe you could just, if we go to Hedley first, maybe Hedley, you could just give a little bit of an introduction of yourself, and then we'll go straight to Sasha. And maybe Sasha, if you could give a short introduction of who you are and how you came to have all these red flags and why we're here today. Hedley, please, welcome.
Hi, Debbie. Thanks for that. Well, since 2005, I've been running my own consultancy in biopharmaceutical drug development and the associated supply chains. Prior to that, I was in biotech for 10 years, working with high-profile companies such as British Biotech and Vernalis. And prior to that, I spent 16 years with Bayer in the UK in Bridgend. In the days when the industry was fully integrated, I'm going back to 1980, where everything was made under the one roof. Today, the whole supply chain is so fragmented, I don't think people would understand it. But since I've already spoken, I'm sort of really glad that Sasha's here. She knows so much of the inside story. I'm just looking forward to what she's got to say.
I'm going to hand over to Sasha because Sasha, you've given some amazing evidence at the Corona Investigative Committee. You've been very vocal on all your findings. And I'd really love to know how you and Hedley managed to find each other and team up together. And also, what were the red flags that first alerted you to what's going on? So with no further ado, Sasha, welcome.
Thank you, Debbie. Thank you everybody for inviting me. My background is I worked in pharma industry for more than 20 years, and in various roles. I started as an analyst working for large pharmaceutical companies in the US, and I also then worked in clinical trials space. I founded my own companies eventually. Several of them, we worked as contractors for pharmaceutical companies, specifically running certain types of clinical trials focused on safety, safety in humans primarily. And I worked all over the world. I had 60, 70 pharmaceutical clients, and many of them were large ones. And Pfizer was my R&D partner twice and invested in my companies. And I worked with R&D, people in research and development in Pfizer, also in safety testing and internal labs that they had at the time. And so, I retired from the industry because I sold my companies and I thought I was going to have, great time. I love art. I was doing art. I wasn't doing anything industry related. In 2020, I became increasingly concerned.
Well, that's just a little introduction to the whole interview. What I didn't say previously was you can find the video available on the UKCOLUMN website, ukcolumn.org, and also be on their channels on Odyssey and Rumble sites as well. So if you go to any of those, you can find video there. But I say I'll leave the links underneath anyway. So enjoy. New information well worth taking in. So we'll see you on the next one then, people. Bye.